Hi, today I'm with Dr. Ryan Lee from Thomson Specialist, and we are going to talk about a hot topic, menopause. So thank you for joining us, Dr. Lee.
Thank you, Kelly, for having me.
What exactly is menopause?
So actually, menopause is defined as 12 months without menstruation. And menopause actually is a natural biological aging process, and it's actually part of a woman's reproductive cycle. And menopause actually marks the end of this reproductive phase of her life.
So what are some of the symptoms then that come along with menopause that women should be prepared for?
So there's actually a wide range of symptoms that women may experience. Some may have mild symptoms, such as just feeling tired, or they do have severe symptoms like severe insomnia, or very bad physical and emotional symptoms like feeling low in mood, or complaining of vaginal dryness, or they may have hot flushes or night sweats.
Do all women experience all these kind of symptoms when they are going through menopause?
Actually, interestingly, 6 in 10 actually experience moderate to severe symptoms, but actually only about less than 5% actually do seek help to address these problems.
Which means that actually less than 1 of them.
Yes, so actually it is
help.
a very underreported problem in Singapore itself.
What exactly are some of the treatment options that women actually can look to for now?
There's actually a whole variety of treatment options that women can actually undertake. So it could range from traditional Chinese medicine to Western medicine as well. And the approach is multidisciplinary, so it involves them having lifestyle changes to medication. So for lifestyle changes wise, they could actually adopt a healthy lifestyle, such as having a good exercise, maintaining a healthy balanced diet, keeping their weight in the healthy range, watching what they eat, and watching for their cholesterol and blood pressure levels as well. And as for medications, there are various style medications available, ranging from topical treatments for hot flushes to night sweats, and to even oral medications in the form of hormone replacement therapy in women who suffer from various symptoms. The traditional Chinese medicine physician does prescribe acupuncture as well as medication that can help them to balance their hormonal status and help them to improve their menopausal symptoms.
But why is it still that there's a very low percentage of women that actually seek help for it?
There is actually a stigma that is ongoing among menopausal women, and this is because of their upbringing perhaps, and of course they would actually try to endure the symptoms of menopause rather than embrace the symptoms of menopause. And a lot of them actually sort of dismiss their symptoms and try to live with it rather than actually seek help for it. And I think this stigma is also due to a lack of education and a lack of public awareness about menopause, knowing that menopause is actually a natural aging process and it's not a disease.
So Dr. Lee, what is the advice that you would give to women who are expecting menopause to happen perhaps in the next 5-10 years, or who are already undergoing menopause now?
To actually know that there's help available. If they seek help early, it would help them to empower their lives better, to embrace these symptoms better, and to take charge of their lives even more.
You mentioned we have to be responsible for our own health. There is really nothing to hide from your own medical professional and doctor.
Right.
That's where you can actually notice the symptoms early and, like you mentioned, catch them early so that we can administer the treatment at the right timing. So really thank you so much, doctor, for sharing so much good information with us about menopause. Thank you so much.
Thank you, Kelly, for inviting me here today.
Now, earlier on, we heard from Dr. Ryan Lee on what menopause is all about from a Western perspective. Now, we are really glad to have physician Seah from Thomson Chinese Medicine to share with us how is the TCM perspective like when it comes to menopause. Thank you for joining us today, physician Seah.
Thank you, Kelly.
So, from a TCM perspective, what is menopause?
From a TCM perspective on women's health, every 7 years is a milestone. So we start menstruating at the age of 14, and by the time we hit 21 to 28, that's the best time to conceive. And when we hit 49, that is when menopause kicks in.
There are general symptoms that women will experience just before the menopause period or during menopause. What kind of general symptoms are we looking at?
Well, actually, for different women, it could be very different symptoms. Yeah, so for example, one day it could be somebody coming in because of a gut issue, a problem that she never had, and suddenly she just developed sensitivity to certain foods, or it could be very poor digestive function out of a sudden. Yeah, and then when we look closer and then we realize that, she is at that age, that is, we say, very near to the 7-7-49. Yeah, so this could be the start of the menopausal period, even though she is still having regular menses. And for somebody else, it could be no hot flush, no night sweats, but just start to have insomnia. But for some women, actually for most women, they will come only towards a very late stage. And by the time they come, it could be they are having the symptoms for already 1 or 2 years.
So like you mentioned, the many women actually put off seeking medical help until a very late stage, right? How often do you see patients coming to you specifically for menopausal symptoms?
The percentage or the number that actually comes to seek help for menopause is actually very low compared to the rest. Unfortunately, most of us, when the symptoms start showing, we are very good at, putting it off, masking it, pretending it's not there, until, we can't cope with it anymore, and then people seek help at a point in time. In fact, a lot of women are still not aware that solutions are available.
What are some solutions that they can look at to address these symptoms that we spoke of?
So TCM is a very tailored a very tailored approach to managing individuals' health. So when they come, usually we'll look at the symptoms, we'll try to understand their body constitution before we make recommendations, whether it is through acupuncture or Chinese medicine. Acupuncture is known to regulate our nervous system, our immune system, as well as our endocrine system. So it can have good beneficial effect to help women who are struggling with either their gut health or whether it is their sleeping issue or pain issue. Now, when it comes to irregular menses, acupuncture can still help, but at the same time, we will likely to use Chinese medicine as well, because this is a time that we see that there's a significant decline in the kidney yin and energy. And this is where Chinese medicine can come in very useful to boost this kidney yin and essence. So definitely we cannot bring the woman back to how she was in
We cannot reverse it, right? Not possible.
Yeah, unfortunately we cannot reverse, because this is a natural progression in life. So but what we want to empower women is to age gracefully and to delay the decline, or to pace the decline. If we can do this gradually and give ourselves time, to work into that pace, then it will definitely be a smoother transition. Our recommendation is definitely to nip it in the bud early as we can.
To start early, to visit the TCM specialist early to see if there is any problem that needs to be addressed at that point in time. So thank you very much, Ai Wei, for sharing so much insightful information with us so that we can all be more empowered to take charge of our own health. Thank you so much, Ai Wei.
Thank you, Kelly.